everyone, welcome to this session. I'm Sandra Nikuze, and today we're going to look together what is electronic health records, its benefit as well as issues related to it. Something by understanding what is electronic health record mean. This is a system that combines patient health records and health medical records. Its goal is to enable data collected from individuals to be accessible uh, internationally or regionally as well as nationally. You can ask yourself, what is patient health records? Patient health record is a system used by patients to record, to access health information, how he has been improving or how he has been suffering. Then health medical records is also a system which is used by physicians to record different information that has been collected from individuals who came to visit a physician. So as now you understand those key terms, now you can have a clear image of what is electronic health records. So now we can continue with what compose with electronic health records. In this session, we are going to focus on two components that support clinical cares and also two components that support administrative procession, and we are going to look on the benefit as well as issues related to those components. Starting by clinical care, the two components that support this clinical care, those are clinical documentation component and also physician order entry. What is clinical documentation component? This is a component used by physician to record different information. In these components, it include vital signs like those information about the patient, like such as temperature, the weight of a patient, and also it include or physician observation. When a patient goes to see a physician, there is a way a physician is looking like outside symptoms. There is it also, like this clinical documentation include those physician observation. There is also past information about a patient. As it is not the first time a patient is going to visit a physician, there are past information or past illness information that a patient has faced. Then in this component, it is also included. There is also a part which a physician used to record a present illness. After that, it also contain plan or treatment a physician is going to provide to a patient. And also the second component was physician order entry, where a physician used these components to order different things to a patient. For example, he can order a lab test, or also he can order prescription to a patient. So after understanding those two components, you can ask yourself, what's the benefit of them? Why do we need those, like the importance of having those components? First of all, it helps in increasing patient health care. What I want to mean here, first of all, like the physician is not going to spend too much time in non-medical things such as finding pens to use in writing forms where he's going to fill. Then he's going to take his or her time, concentrate on providing care to the patient. Then the second thing, the physician is going to provide online resources to a patient so that a patient can have a clear knowledge about how he can or she can improve his or her health. Then also a physician is going to use those information in doing prescription. So like in the past years, they were using papers to write prescription. then it was really hard, like a patient could miss those prescription. Then using this component is going to help a physician and also a patient not to lose prescription information. And again, while ordering prescription, this is the e-prescription is going to help physician to get like alert if a medication is going to harm a patient, then he can know or she can know what to do in order to prevent any harm to a patient. Then after understanding the benefit of using those two components, we can now see on the issue related to those components. First of all, there is time consuming. According to Amawaya writers, they say that there are some clinical components which are not well designed and make physicians spend too much time documenting instead of spending too much time providing care to the patient. The second issue related to this is that physicians are claiming that they are having too much information to include in clinical documentation component. They are saying like there are some information that could be entered by other people and they're the one to enter them. If it is possible, they can like reduce information that are entered in clinical documentation and then give them to other people. So after having or after understanding the two components that support clinical care, now let's talk about two components that support administration. The two components are appointment schedule and basic data collection, basic information collection, and electronic check-in. So you can ask yourself, what is appointment schedule and basic information collection? This is a component a patient use before coming to visit a physician, where he can or she can schedule, she can ask an appointment, and then also fill some basic information such as geographic and some like past medication information. Yeah. Then in this component, the administration is going to know how many people are on list, how many people need to see a physician, and plan accordingly. The second component was electronic check-in. After a patient reach on the hospital or in the clinic, they are going to go and prove what they have said, if it is right or wrong. Then they need to say what I said was true and also provide billing information. Like if he's using, a patient has an insurance, is where he's going to talk about and which kind of insurance is he using. Then administration is going to use those information to see like to help them in asking the request form and also checking if the patient is really providing those true information. Then after now understanding those components, let's look on the benefit of them. First of all, there is communication in the office or communication among the administration. What I want to mean here, like if an administrator sees like how many people are on list, they are going to plan accordingly and they are going to allocate patient on the right physician. Then in this again, it is going to help, as I was saying, it is going to help in preparing request form to the insurance companies, as the patient have already talked about the insurance they are using. Then the administration is going to use those information to make a request and also making coding in order to request money the patient used while visiting the physician. Then issues related to this is that sometimes a patient can use a wrong electronic health record system, thinking that it is the right one. Then after reaching to the clinic, the patient is going to miss some information, or like a system say you did not ask any appointment, then he can face different challenges. The other thing is that it is not accessible by each and every one. For example, if someone is not aware of how to use computer, then it will not be possible for them for those people or for some people to ask appointment, then the health care of someone is going to be down due to the unable to use computer for asking an appointment. Then the last thing we are going to talk about is importance of administration and clinical care in effective use of electronic health records. So I can relate this to the normal life, like when like a population used to follow what leaders are doing. This can be applicable in also in health or in administration and clinic care in the effective use of electronic health record. Before a patient can understand why do I need to use electronic health record, a physician or and other administrators needs to understand and use them effectively so that a patient can apply what the administrators are doing. The second thing, if administration and also physician use them and do not allow any person who don't like any patient who don't use them to come and meet or like to have a visit, the patient will be obliged to use electronic health records. And also the other thing, the administration or the clinical care needs to prepare a workshop explaining why do people need to use electronic health records. If they present those things, or if they have a workshop explaining about electronic health record, the majority of people are going to use effectively electronic health records. The other thing, administration and clinical care needs to provide feedback to electronic health creators so that they can know what to improve on, how they can help those people who cannot access or those people who don't know to use a computer to have also access on electronic health records. If administration and clinical care don't use them, people should not think that other people are going to use effectively electronic health records. First of all, let the administration, clinical care, physician use electronic health record, and also other people are going to learn from them. Thank you for your kind attention.